Hi everyone, this is my week 5 discussion on cohesive mental health care. So the resource I selected was an image from an article titled, "Is Forced Treatment for the Mentally Ill Ever Humane?" I didn't have full access for this article, but what really interested me was the image for the article itself. I found the image to be very powerful and very moving, and I believe it encompasses how coercive mental health treatment can feel for many individuals. What I feel that the image is conveying is like a loss of autonomy, loneliness, feeling powerless, broken, or wrong. And these are all things that I feel increase the mental health stigma um, and can just build mistrust, which can impact these patients or individuals from getting help in the future once they've been in once they've been forced into treatment. So, for the self of the therapist response regarding the subject matter, I think it's going to be very important for me specifically to be aware of any biases that I may have, especially considering that mental illness and substance abuse does run in my family. There is a lot of family members that I have that do suffer from mental health conditions and who do suffer with substance abuse. I need to make sure that I'm not imposing my own experiences that I have with these individuals in my family onto the clients that I'm seeing, and that I need to be very open and aware that every experience is unique and their own, so that I'm treating every client based on their experience and their issues that they're having. So, when discussing ethical considerations in coerced care for people experiencing substance misuse or psychosis, I definitely think it's going to be a very tricky balancing act. It's it's going to be something that you have to take a lot of these ethical considerations into account, such as like the client's autonomy versus the benefits, uh, the benefits for the client, and then um, the informed consent and whether that client is able to give informed consent. Um, I think these are important things to consider, but specifically for this, I think in any situation it is important to respect the client's autonomy as much as possible. Um, so with that said, I do think it's important that I also think it's important that all other avenues of care are looked into and exhausted before thinking and going into coerced care for people experiencing substance misuse or psychosis. Um, and overall, I think this just needs to, everything that is being done does need to be for the well being of the client. That should be the topmost priority. Um, so I definitely think that there's a lot of ethical considerations to consider when discussing this topic. And then here's my reference for the image that I used. So yeah, just wanted to say thank you so much for listening. Have a great day.